Hi, I'm Dr. David Hill, and today we're going to be talking about how do I treat infant reflux. Well, the first thing to know is that infant reflux is often a very normal process. Almost all babies are going to spit up to some extent. We now think that that may be a mechanism by which they take the good bacteria that are found in maternal breast milk and spread those bacteria throughout the airway. So if you're nursing your infant and he or she is spitting up some, you can feel good about it even if you find yourself having to change clothes quite frequently. Now, gastroesophageal reflux disease, or GERD, that's the term that we use to describe reflux that seems to be causing a problem. What kind of problem? Well, excessive pain, poor feeding, chronic nasal congestion, chronic cough, wheezing, or chest congestion can all be signs of gastroesophageal reflux disease. This is something we do want to treat. How do we treat it? Well, the treatment can start at home. The first thing to do is make the feeds a little smaller and maybe feed a little more frequently so that the calories the baby gets over the course of the day are the same. If you're feeding your baby from a bottle, you can add 1 ounce of rice or 1 teaspoon of rice cereal to every ounce of formula or breast milk that's in the bottle, and then you can shrink those feeds up by about 1 ounce and get the same number of calories in the baby every day. That may help by decreasing the quantity of food that's in the baby's stomach. Less down there, less to come up. You'll also try keeping your baby in an upright position for 30 minutes or an hour after feeds. It can be a little difficult after a while, but you can give it a shot. People say, do I need to change what I'm feeding my baby? Well, if your baby's on formula, the answer is maybe. Changing formula only helps reflux in about 2 to 5% of cases. So most of the time, we go through 2 or 3 formulas and we never find one that works. The good news is that baby reflux does get better after about 4 months of age in most cases. Not every case, but reflux tends to peak at 4 months of age, and then it tends to get better after that. Now, there are medications that we use, antacids, including ranitidine, which is Zantac. We use the proton pump inhibitors, such as omeprazole or lansoprazole, and those can be very potent reducers of stomach acid and help to some extent with reflux symptoms. Bottom line, if you've tried some things at home and you think your baby is still spitting up to an extent that is alarming or causing problems, do work with your doctor to get some help on that. Talking about how we treat gastroesophageal reflux in infants, I'm Dr. David Hill.